Hello and welcome to Life with Dr. Amanda. I'm Dr. Amanda and it's time for another Medicine Monday, where the aim is to educate, empower and equip you with the knowledge that you need to live your healthiest life. Today is all about empowerment, today's video is, and it's part of my Black History Month specials on Medicine Mondays. All of the month of October I am interviewing some Black, British, female doctors that have been really inspirational to me, and this is the second installment of it. If you missed last week's, after this video pop back and you can see my interview with Dr. Nella Grace, but today I'm interviewing the amazing consultant dermatologist Dr. Sharon Belmo, and I really hope you enjoy. So with us today, we have the incredible Dr. Sharon Belmo. Thank you so much for joining us today. So we were just having a little chat, and actually this is the first time me and Sharon have actually spoken. We've had a little bit of back and forth on our Instagram DMs, but this part of my channel, this series, is because when I was younger, I really wanted to see more Black women, people that look like me, and see like them doing just amazing things out there. And I think now with the internet, everything, we can get access to more people. And I think it's really difficult sometimes to be something that you never see. And so I just wanted this Black History Month to get a few more of our stories out there, so that some more people can just see what incredible people Black women can be, basically. And so thank you so much for coming. It was I know, because both of us, we are dealing at the moment with time difference of about 5 hours, I think.
Yeah, 5 hours.
Yeah, Sharon, you're in the US at the moment, and we've also got 2 toddlers between us, and so getting this coordinated, I'm proud that we made it here.
We've done well.
And so this series, I wanted to choose some Black British female doctors that I was inspired by. And so I thought I'd just start by sharing how I actually came across you. And so on Instagram, I saw a few different people in the medical world had shared a picture of a new curriculum for Black, for the skin of colour that has been brought out. And I've been saying this since I was in med school, that you look at something, you see a picture of eczema that you're taught this is what eczema looks like, and I'm like, but my cousin's got eczema and it doesn't look like that. I'm going to be able to spot it. It doesn't look like that. And I always saw this gap. But dermatology isn't my specialty. I'm in general practice, and I just thought, I just always saw there was a gap there, because everything that I was shown in med school was always on Caucasian skin. And so when I saw this, I went onto the profile and I was like, wow. It was just amazing that you had done this and created a curriculum for the Royal College of Dermatology. Is that right? For the trainees?
British Association of Dermatology.
And so I just thought that was amazing. And then I went onto your page and I saw that you had a daughter, not too dissimilar age to mine, and also that you look amazing. Honestly,
thank you.
Your fashion, everything, the way you present yourself. And actually myself, since becoming a mom, I'm still trying to work out my own like fashion sense, and just like my body's changed, and sometimes I'm so tired and you feel frumpy, and then you don't end up doing all the things that I used to do beforehand. But seeing you and seeing how you're doing motherhood as well, and how great you look,
thank you.
Come on, Amanda, you can do this. That's why I was so inspired by your motherhood journey, but also your medical one too.
Thank you so much.
And so we will get more into what you're doing now in a moment, but this is for my Medicine Monday section. So I'd love to hear about your journey into medicine. What made you decide to do medicine, and what did that look like for you?
So I as you can hear from my accent, I'm Scottish. So I am born and raised in Scotland, and I went to med school in Scotland. I went to med school in Dundee. And so growing up, I wasn't around anyone of color at all. I'm from a town just outside Glasgow. We were, the only Black kids in school and everything. And actually, when I told my dad's a doctor, although he didn't push me into medicine, but you know, I was good at science. I liked science, and you know that's just it just naturally progressed that way. But when I told my teachers at school that I wanted to do medicine, they discouraged me and said, "Oh, are you really sure? Because in Scotland you do hires, not A levels. Are you really sure you want to do 5 hires?" And I remember my dad was so angry, you know, when he heard this. And anyway, I did it, got the hires, got into med school, and yeah, Dundee was really good. Enjoyed it. I learned quite early on that I liked surgery, but I was more of a medic. So did core medical training in Liverpool. So I graduated 2006. Left work, did foundation there. It was 2 years at the time, and so worked for 2 years there. And then I've been in England since 2008. So I did my core medical training in Liverpool, and then I did a couple dermatology jobs in Newcastle and Liverpool, and then I did my dermatology training in Nottingham, and I finished just at the end of 2015. I left 2016 and moved to London. One because my now husband was there, and then also I just needed to be around diversity because I noticed as soon as I started dermatology training that, like you say, there was a gap. And I remember when I did a job, a dermatology job up north before training, and I was really junior. It was my first dermatology job, so I was really junior and shy. I didn't want to say anything. And the consultant had a patient, an African lady who had hair loss. And some in dermatology, we have for complex cases, we have these meetings where we bring the patient and everyone sees the patients and we discuss. And I remember the consultant trying to describe the hair loss the lady had, and I think she had a weave or braids or something at the time, and she came into the room saying, "Oh, we can't examine her because she has this intricate meshwork of something on her head," and she was trying
Oh
to.
my goodness.
And I was just, yeah, exactly. I was just sitting there, young and shy, and just thinking, "Are you serious?" And this was 2011, and I just thought, "No." Like, well, as soon as I finish, I have to do something because this poor woman is sitting there. The way that she was being spoken about, I just didn't like it. And yeah, when I did my derm training, I noticed, although in Nottingham training was very good, I trained in a really, really good center, but the focus was white skin. You know, the books that are used not only in Britain, everywhere, they're white skin. Um, what I didn't like was when you did see skin of color, it would be in the infectious disease section. And when you would see once in Nottingham isn't that diverse, but when you would see a patient of color, quite often, oh, you know, the question of, you know, have you tested for HIV or some sort of infectious disease would come up, which I would hate because I'm born and bred in Scotland. Say I wasn't a doctor and I went with a rash, eczema, and I'm asked about HIV or TB or something, I'd be really annoyed because
Of
my
course.
risk is the same as yours, you know, and there's so many Black British people that haven't traveled. So, you know, they don't, I mean, anyone can get an infectious disease, but
But
it was,
you don't assume it for everyone, and to
you
assume it
don't,
just based on your skin color.
exactly. I would hate it. And, you know, sometimes they would ask you, I don't think it's the same now. I don't know if you need consent to test for HIV now. You would know more now, but then it was really,
Hmm.
and I would feel bad asking because I would see them looking at me like, why, you know. So
No,
infections,
yeah, you don't have to ask for. You don't
you
have
don't
to
know.
ask for consent now, but
Yeah,
it's very awkward to not ask for consent and then
I
explain it.
think so. Yeah, I think so.
I don't know many people that really go ahead and do a test without asking, but technically you don't.
Yeah, it'd be a bit strange. um, but yeah, so yeah, there was a gap, and I didn't like the overrepresentation in the infectious disease, you know, parts of medical training. And so as a derm registrar, I started, you know, there wasn't really anyone to teach me. There was a one consultant in London, Ophelia Dadsey. She was the only other black derm that I knew that was interested in skin of color, and I did a few papers with her. My other interest is hair loss. I did a few papers on hair with her, and then I would just come to the States, travel, go to meetings, and just do it myself. And at the end of training, I set up this skin of color resource with Center of Evidence-Based Dermatology, which is based in Nottingham. And I have a really amazing, he's still my mentor now, Professor Hal Williams, who I mean, he's been around for a long time. He's an epidemiologist, but he is actually interested in diversity, even though he's a Welshman, but he saw the gap as well. So he really supported me and let me set up this resource. And yeah, I've just continued to do as much as I can. Being in London helps because then I'd be around, people of color and see more patients. But yeah, I just continue to push it. I really, really believe that UK is behind, and we really need to. There's a huge gap that we need to fill. There's no
Absolutely.
excuse. Yeah.
Absolutely. And the thing is as well, so many parts of the UK, although was ethnic minorities, black, skin of colour, we're what, 3% of the population in the UK.
Yeah.
But we're all over the UK, and even
Exactly.
in areas where we're not as prominent, where we might be more of a minority, say up north or anything like that. Still, when you go to your doctor, that shouldn't be a reason for you not to be treated. And 10% of the population is like more than 2 million people.
Exactly.
You can't not know how to treat 2 million people. It's not fair. Yeah. So thank you so much for the work that you're doing. Honestly, thank you.
Oh, hey, you're welcome. I'm trying. It's not easy, but I'd say the last year has been easier I've been trying to do this since I started, especially since I was a registrar. But I'd say it's been welcome more over the past year and a half, with Black Lives Matter coming more to UK and people becoming more aware that diversity was a thing, and organizations kind of releasing statements and whatever. So I'd say they've been more receptive over the last year, but this is not new. This has been an issue. People have been working on this, especially here in the States, for a long time, way before George Floyd.
Yeah, absolutely. And I think the thing with George Floyd and everything that happened last year is that people couldn't ignore it anymore.
Exactly.
And it happened during the pandemic when everyone's at home watching their TVs. It meant that you couldn't pretend that you didn't see it. You couldn't pretend that you didn't have time. Exactly. And so now we have companies and big organizations and people in power, they have to show that they care. They can't. And even if they don't care, they've still got to act like they do, and they still
have to, because if they don't, then it'll look like they're racist, or so it's difficult to know who's genuine, because now all of a sudden everyone is releasing statements, and maybe some weren't familiar with what was going on, which is fine, but with everyone all of a sudden releasing statements, you do wonder, are you doing it because you genuinely or you're doing it just as a tick box? Because why did you not do it 2 years ago? Or so I have a little issue with that. I hope it's genuine.
Yeah, and time will tell. Time will tell.
Exactly. Yeah.
But you alluded to it at the start, but we just started talking. But I wanted to know more about your background and your upbringing. I know that you were up in Scotland, not many Black people around, but what was your childhood like? What's your ethnic background as well? How was it growing up?
So I was born in Edinburgh, but I grew up mainly just outside Glasgow. My parents are from Ghana. Originally, they came to Scotland in the 70s. And but my dad's family are all here in the US. So I would visit Ghana and the States as a kid. So I would have influence, Black influence growing up as a kid. I had none in Scotland. It was tough. It's changed now. It's more diverse, but in the 80s, 90s, it wasn't. And it's good, because as a young child, I didn't really notice that I was Black or that there was a difference in color, which is good. I didn't notice it until quite late. I think I was in high school, and it was more because because maybe because we were coming to the States so much, my brother, sister, and I liked, Fresh Prince, like different music, different, and they liked other music. And I noticed the cultural differences more. And then, once in a while people would say things and I really started to understand what racism was, so luckily I didn't learn what it was until quite late, thank God, but it was there. The problem in Britain is it's subtle.
Yeah,
So, as you get older, you learn to read the signs. At university, it wasn't so bad because even though it's in Scotland, most universities are quite diverse. So, I was able to mix with, different races. So that was nice. But no, I mean, I wouldn't say I went to public school. I think it was private school. My parents were just, really supportive. Education, African parents' education was important. And I liked studying, to be honest. I was quite academic naturally, so I didn't really have issues. They didn't really have issues with me.
yeah,
But they were supportive. And I did long for diversity though, as a late teen, early 20s, I did long for it. So I did quickly want to move to England because I saw it was more diverse. And then the further south I got, the more I felt like, no, I just need to be in London because it's the most diverse place. I really like Black people. I do. I'm really pro Black. I really like to be around Black people. I'll say it, and I feel at home, and I really like to help not just Black people, people of color. I just like to help them if I can, because I feel like they're kind of left behind. So I'm very pro diversity.
yeah. Excellent. And the thing is, with the Black experience and like the Black diaspora and everything, when you're even when you're from different cultures, say, from the Caribbean, from West Africa, South Africa, all those different cultures, you often find, especially when you get into those late teens and early 20s as well, you often find a lot more identity.
Yeah.
A lot more, just being able to resonate more with people and identify and
Definitely.
just learn more about your just how varied you can be. And so even though I think it's wonderful having people from all different backgrounds, but I think it's a lot to say, actually having people that look like you, having Black people around you.
Definitely. It's hard to be alone as a Black person, I think. And yeah, I mean, everyone's different, but I know I longed to be around Black people. I did. Naturally, that's just what I gravitated towards. I like my people.
Yeah, and the thing is, your upbringing sounds quite unique to me, just because so I'm from a Caribbean family. My family's from Jamaica, and so my grandparents, along with a lot of people from the Caribbean, came over in the 50s, the Windrush generation. And then when I was younger, that's when I saw more people from Africa, so from West Africa, from Southern Africa. That's when I saw more of them coming, and more people that I know that are from an African background. A lot of them were born out in Zimbabwe or Zambia or Ghana or Nigeria from my friend group. Whereas you're kind of in the middle of that.
Yes.
Also went to Scotland as well.
Yeah. That's the other difference, because my brother, sister, and I all have found that not difficult, but we're a bit unique, because if we go and visit family in Ghana, we're not Ghanaian, we're Scottish. Like, oh, our Scottish cousin, we speak Scottish. The mentality is different. In the US, they just think everyone's from London, so we're their British cousins. And then when I'm in London, I'm like, I get a lot, you're Scottish. I've never met, you're the first Black Scottish person I've ever met. So Yeah, I get that a lot.
Yeah,
um
because what you're experiencing is more like what my parents experienced. So my parents, they had a lot of cousins that might have been born in Jamaica, and they had that whole identity of am I? Because in England you're not English, and then in
no,
Jamaica you're not Jamaican because you're the British or the
yeah,
English people. And
yeah,
the same thing for me. Also having that of people ask where you're from, and I'm like, literally, I was born here. My parents were born here, but less so. And I can see from what you've experienced more maybe what my parents' generation and that generation
yeah,
Caribbean side
yeah,
experienced.
yeah. That's the thing. Yeah, when people ask where you're from, you don't know. It depends who asks and where you are. In London, when people ask where I'm from, it's usually because they hear my accent and they don't know where to place it. In Scotland, where I'd be asked where I'm from, it would almost, even though, my accent is softer now. When I was living in Scotland, it was stronger.
Mm.
And even with that, I would still be asked, where are you from? Where you're from? It's like, I'm from Ayr. It's just outside Glasgow, but they want to know where your parents from,
Yeah.
where and yeah, I've always hated that question, to be honest.
Yeah, it's just awkward,
Patience.
isn't it?
It's yeah,
Yeah. And I remember being quite awkward with it back, just like
same.
I'm
Yeah,
from Hampton. So
yeah,
what,
yeah, same.
England? Britain?
Yeah, yeah,
What?
yeah, same.
Now
I'm
where you
not gonna give you what you want.
from? My dad was born in Warsaw.
Yeah.
To
What do you mean? I once, I remember when I was I was F1, and I was in Dundee, and I had this I was taking blood from a really old woman, and she asked me where I was from, and I told her Ayr, which, so if you're Scottish, you know where it's like, I don't know, saying I don't know, Coventry or somewhere,
yeah.
you would know where it's from. And she said, Ayr, what part of Africa is that? I just thought, wow, you're so blinded by my color that I've just told you that I'm from just outside Glasgow, and you're still thinking about Africa. So they kind of listen with their eyes.
Yeah, exactly.
Yeah.
Um, but with all of that and with the background that you've had, I can imagine that although you've got a big passion in medicine and skin and colour, there's often many things that make us up as people. Do you have any other passions, interests outside of medicine? What kind of makes you tick?
So I'm absolutely obsessed with fashion. I
Honestly, guys, I'm going to link everything down below. Okay, Instagram. You look amazing every day.
Oh, thank you. Yeah, I'm upset. If I, to be honest, when I was at school, I wanted to be a fashion designer. I did art, I did science and everything, but I did art a lot. I did art. I first thought I would go to art school, and I still like art, fashion, art, music, hair, anything natural hair, Afro hair. Um, and yeah, fashion is definitely my thing.
Oh, lovely. Amazing.
Yeah.
How have you found it since becoming a mom? Have you found that your fashion sense has changed or like functionality, or do you just kind of say, this is how I dress and the mom things has to kind of fit in afterwards? Have you found it?
It hasn't really changed. I mean, if it's changed, it's changed more with, the fashion changing, to be honest. Maybe it's changed because I'm not um going out as doing the same things I was doing,
Mm-hmm.
pre-COVID, pre-motherhood. So I wouldn't be wearing certain things because of that. But actually, I really like fashion.
Yeah,
So
excellent.
yeah, I would probably, at the beginning, when you're lying in bed a lot while, baby is really little, I'd be like shopping on my phone and doing all these. Yeah, it hasn't. I really love it. So I just incorporate it, and I have a girl, so I
Yeah.
absolutely love buying dresses, and um hopefully she likes fashion as well.
Yeah. She has no
But
choice, she's gonna have to.
she has no choice. Yeah. No, it's my passion. It's nice because it's very different to medicine, it's completely separate. So and you can express yourself, 100% that way. So for me, it hasn't changed. I just fit it in.
Excellent. That's amazing. And the thing is, I, I still feel as though before I had my daughter, I was very used to shop quite a bit, and um, I took a lot of pride in how I looked, and I was going to say I was quite fashionable. It's not
Yeah.
that I'm not now. It's just that my body's changed, and
Yeah.
finding the time to go to the shops, because before I might be able to do like this big online order, know exactly what things are going to look like on me because this is the body that I've had for so many years. And then
Yeah.
now I order online, I'm like, okay, this didn't look
It
how
doesn't.
I expected, and I don't have time to go to the shop right now.
Yeah.
Make it more of a priority, definitely, because it just makes you feel good when you look in the mirror and you feel that you look good, and I feel like it helps with my confidence. It helps if
Yeah.
I put myself together, I can just feel like my day is going to go better.
It does make you feel good. I think it's important for women, especially when you're, I mean, if some, not everyone likes it, but when you're busy mom, busy at work, you have to try and find some time to look after yourself. It might not be fashion, for some people it might be having massages or gym or, but if you can try and find the thing that you like, that kind of not defined you, but was really part of you, was your passion, even if it's just, a small amount. I think it really does help because you need the release sometimes.
Oh yeah,
You
absolutely.
know, it's just little joys. It
Definitely.
helps. It really does help.
I
Yeah,
think sometimes you can find yourself in parent once you become a parent or a mom, especially. Um, if you're not careful, it can be easy to get yourself lost in the role of mom,
100%.
and
Yeah,
especially when you've got a busy job as well, just getting lost in the role of mom and doctor. This is what I
definitely.
do. But then actually trying to find the Sharon in it and the Amanda in it. That's what's
Yeah,
important, to make sure you find that.
I think so. Yeah, otherwise you'll go crazy because the job is hard. Parenting is hard. You need support, but yeah, you need a balance. You absolutely do. It's not easy.
Mm-hmm. No, not
Yeah,
at all.
I had a lot of late nights, but
Uh-huh.
what can you do? Are you okay?
One moment.
Really?
Oh, Susan, I'm only going to be about 15 more minutes.
Oh, oh no.
Okay.
Oh, it's not
A
easy.
little bit of shouting in the background.
Really?
Oh gosh.
I left my parents are here as well because
Yeah.
I've left them with the baby cam because I knew otherwise it would happen. It would, so.
Okay, that's
uh,
fine.
oh,
Okay, we'll see how
one,
it gets.
okay.
Um,
Oh,
sorry.
no.
Okay. So next thing I wanted to ask is
Yeah,
what. So with all of that, especially talking about motherhood as well, what does
yeah.
life look like for you now? Um,
It's busy.
yeah, I can imagine. I can just
Yeah,
imagine how busy it is. But often
100.
I like to do a little. I think it's good to reflect on things, and
Yeah,
sometimes I like to just think back 5 years what I thought life was going to be like. And
yeah.
often the reality of it is so different to actually what I imagined, what I dreamed of, and things. But what does life look like for you now, and how does it compare to where you thought you would be?
Okay, so I was have always worked in the NHS up until June. I just left NHS in June. I was full time before I had my daughter, and then I went part time. And for different reasons, I decided to go fully private. So which has helped a lot, work wise, and being a mother. I've got more flexibility. So right now, I'm working 3 days a week, partly private practice, partly academic. I'm now doing a lot more academic work. I don't know, you see all the things.
Yeah.
Posting, yeah, so I'm doing a lot more academic work. So I mix those 3 days with clinical and academic. Sometimes, because I like skin surgery, so I do quite a lot of skin cancer, skin surgery. I do for the NHS weekends, clinics, and skin surgery lists. Mainly because there's huge backlog in dermatology now, especially since COVID. So sometimes I do weekends, and then my husband looks after my daughter. So my daughter is only in nursery 2.5 days a week. The days that I'm not at work, I'm not free. I'm 100% a mom at home. So when people want to have meetings and things like that on my off days, it's really difficult because I'm not off. It's another full day. And yeah, that's basically it. Because academic work, I can't just fit in one afternoon a week. I do find that I have, especially when I'm trying to finish a paper or whatever, I have a lot of late nights because as a mother, I want to be very present. I don't want to have any regrets of working all the time, which is why I choose not to have my daughter in nursery that much at the moment. Maybe from 3 up, I'll increase it because I think they need it. But I didn't want, I think it's good to be in nursery, but not all the time right now.
Yeah.
But it means that I don't have time to do anything. And so when she sleeps, that's when I start writing and doing work. So it's not the best example for sleeping and everything, but that's just what I have to do at the moment.
Yeah.
It's not forever. Because in terms of skin of color work, I feel like I really have to. This is a good time to do work. It can't wait. There's a window, and I don't know if all of this, diversity and inclusion is I don't know how long it's gonna last. So while there's, a window of opportunity, I have to
Yeah.
do what I must, and so I just have to balance it. So I'm busy. I'm nonstop.
Yeah.
I'm nonstop. But when I'm with my daughter, I'm fully present. No
Yeah.
regrets.
And it's quite your setup, apart from I'm not quite as busy as you in terms of work. I'm not traveling to the US or anything like that, but in terms of your setup of the week is quite similar to what I'm doing at the moment.
Is it?
Yeah. So I tried to be really intentional, like with when we planned having children at a time where training could finish. So I'd finished my GP training, my husband had finished his training, and so I was like,
Was he a GP as well?
No, he's in like education, and his
cool.
So he'd done all of that because he did a bit of a career switch in his mid-20s. And so we were like, let's get this all sorted and out of the way so that we can actually be really present.
Yes.
That was important. And so I remind myself of that I did it at this time so that I can be really present with my child.
Yeah.
And so, yeah, I do 3 days a week at work as well.
Yeah.
And my daughter goes to nursery 2 days a week. And she goes to my parents as well.
Yeah.
And then the rest of the time, when it's what you're saying, I'm with my daughter. There's no.
Yeah, you're not free. Yeah.
I'm not free.
No, it's not. People don't understand it.
I'm not. And sometimes I get asked like, "Oh, do you mind helping do this? We've got this meeting, or you're not working Tuesdays." I'm like,
yeah. No, I am working. I'm working from home.
Yeah.
Yeah.
There's no. And so I'm still trying to find this balance of doing other things because my work days are really quite busy.
Yeah, I can imagine.
There's like my platform, Life with Dr. Amanda, I'm trying to develop this, and then also my own educational needs as well.
Yeah.
And trying to find that balance, that time.
Yeah, it's not easy. Yeah, you do have to juggle it. It's for women. It's not easy, but I never complain about it because I had my daughter quite late, so a lot of my friends, the kids are a bit older, and everyone says this time goes so quickly, and they all love to see they're so cute at 2 and everything, and so it's difficult, but yeah, I just try not to complain because I know later I'll say, I'll look at pictures and say, I remember when she was 1. I remember, it was so easy when they did this, and then so yeah.
I'm already feeling it, how quick it goes. I'm like,
I know.
Goodness me. When I look at what we were like last year compared to now,
I know, yeah.
Already going so quick. And so I can feel the time passing. And so I'm like, even if it means I've got to slow down with different things or things are a bit more strained, when I
Yeah,
thought I want to know that I was present in those times.
exactly.
I was listening to a podcast the other day actually, and there is like this mothers meeting, two moms talking, and one gave some advice, and she was like, she always thinks she knows that she can't be a perfect mom all the time,
Yeah.
but she's like, she keeps thinking, you know, people always end up in therapy. If my kids end up in therapy and they get asked what was my mom like, I always think like, what is the worst sentence they could do, and what can I do that day to make them not say that? So she's like, maybe like, oh, my mom was always on her phone. And so when I think of that, I remember to put it down. But
That's really
it was, she's like, she's a comedian, the woman is. And she was like, so I just think about what can I say in therapy and how can I make that better? But it's true, you know, like your experience as a child, it shapes so much of your life, and you're only a child for such a short time.
very short. Yeah. And it
Like,
does, you still remember, you remember things.
and it's huge. It just shapes so much of your life that you want to make sure that, you know, someone's childhood is a great experience for them.
Definitely.
Yeah.
Definitely.
Yeah.
It's fun as well.
Yeah, it is. It is fun.
Yeah. I didn't think, oh yeah, because you asked what if I had what I felt life would be like. I knew I would have children, but to be honest, I didn't think I would enjoy it as much. I changed completely when I had my daughter, you know. I wasn't really broody, to be honest. I knew I wanted to have kids, but I wasn't like looking at everyone's kids and or patients, and I just knew I wanted to have kids. But I changed so much. You know, it's such a blessing. It really is. I used to ask, you know, I'd see my friends or see patients, and they would be complaining about how tired they are and everything. And I'd be like, why do you do it then? Why is it that good? And they wouldn't, you know, I would ask this question, like, if it's so bad, why do you do it? Why did you? And they'd say, oh, I can't explain it. And I'd be like, someone needs to explain it to me because I'm deciding what and it's well, I can't explain it. It's just
you can't.
It's such a blessing. Everything they say is true.
It's so funny. My friend, she's a dermatologist actually, and yeah, and she was saying to me, she's like, okay, Amanda, I know I need to have kids. Like, she's been married a while, and she's like, we want to have kids. Well, we're planning to have kids, but man, tell me the pros and cons. I'm like, I'm like, if I'm going to put it down,
such a medic.
She's like, come on, like, tell me, like, is it really all it's cracked up to be? I'm like, honestly, if I put it down on paper, it sounds like there's a lot more cons. Like, if I, but I'm like, because you can't describe the joy it brings.
No, you can't.
And it really does. My daughter would be like an absolute terror all day. She might be throwing things and biting and everything. And then at the end of the day, she does something like she's a dance. I'm like, oh, you're just the best.
I know. Or they just smile. I know. It's so true. It's definitely, you feel fulfilled, you know. And it's not for everyone, but
no,
it's I wouldn't change it. It's worth all the, you know, tiredness and juggling and everything. It's worth it.
Absolutely.
It's joyful, yeah.
Okay, and so the last question, just to round off, what's next for Dr. Sharon Belmo? Where do you see yourself going? I don't mean, you know, you don't need to tell us any concrete plans or anything, but what do you visualize, or, you know, what's next on the agenda for you?
It's, well, in the UK, it's really developing, establishing skin of color in dermatology, skin of color training. So the curriculum that you mentioned at the beginning, that has been incorporated the syllabus has been incorporated into the curriculum this year. So thankfully, going forward, that's going to be part of dermatology training.
Excellent.
And I'm doing a lot of talks. I'm being asked to do talks, you know, not just dermatology. In fact, I'm doing Royal College of GPs later this year. So if you know, so
I will be there.
Just, you know, skin of color education, not just for dermatologists, but for medics, you know. And I've just launched, I think this is really important, I've just launched a skin of color image bank that for the public, because I have a skin of color resource I mentioned with the Center of Evidence-Based Dermatology. It's more academic because I'm more academic for healthcare professionals. And I remember I was doing an interview with One Extra, and they asked, "Oh, where can the public go to find, information?" And I realized actually they can't go anywhere. They don't really have anything. There are some resources if you're a medic, but for public, there isn't much. So this is an image bank that I'm hoping will develop over the next few months to years, where public submit their images after they've had a diagnosis. So I'm not there to give the medical advice, just so that people can see how conditions look in their skin, and not just in white skin. Because if you just Google, say, eczema or something, it's the top hits will be white skin. So we need more images. So I really, really want to push diversity in medical imaging over the next few months to years. And I do see a lot of hair loss, because skin of color and hair loss, particularly Afro-textured hair, is my thing. So I do want to eventually open a hair loss clinic, but focusing more on Afro-textured hair, because that's something that is really, really, really behind in dermatology. I noticed there are many hair dermatologists in UK, but Afro-textured hair is
Yeah.
there's nothing. So and the women are suffering. So I'm hoping, I see it generally in my clinics, but I want to open a specific clinic for Afro-textured hair.
That's awesome. The thing is, I want to have something like, for me as well as a GP.
Yeah.
And as a Black GP as well. And there's very few Black GPs where I am actually working.
Where are you based? Sorry, I didn't even ask.
So I'm in the West Midlands.
Okay.
So West Midlands, Black country areas like Wolverhampton, Dudley, that kind of area. And so there's actually quite a big Black community here.
Yeah.
But not very many Black doctors. And I know that whenever I've worked at a couple of practices now, and whenever they see me, and I like to work in areas where there are more Black people there, and they're always like amazed, and that's when they start to share things more that they haven't spoken to a doctor before about.
I found that too.
My patients that are wearing wigs, and they're really struggling with hair loss, and they've just never mentioned it. They just don't talk about it.
No, they don't. I've heard this. People come really late to me. I think more people have, found that I'm there, more recently, and some are not even in London, and they come in. It's so true. Quite often the history is really long, and especially the scarring alopecias, like FFA. I feel really, really bad when people are misdiagnosed as having traction alopecia when actually it's not. It's something that FFA is a condition that anyone can get. It's not just Black women. It's not just because you wear braids. And
I remember I saw this one woman, and so we'll finish, but I saw this one woman and she was told before that she had traction alopecia and that she needs to do her hair not as tight. That's what she was told. And so she came to my clinic for something completely different. She was wearing wigs and everything. She was like, I've never seen a Black I've never had a Black GP before, no Black doctor or anything. She goes, she's like, I know it's only one problem, but do you mind if I just show you this? She took her wig off, and I was like, that is not traction alopecia. Oh my goodness. Wow. And it was at the state where I just referred to her. From my expertise and everything, I didn't know what else to do for that really, because it was really quite severe. And but I also have the confidence that I'm sending my patients to somewhere they're actually going to get proper help.
Yeah, that's the thing.
And that's why it's amazing if, even if it's clinics that are private, because sometimes I advise my patients to go privately, but actually having a resource that I know they're going to get some help.
Yeah.
So important.
Yeah. I'm practicing privately now, but I do hope, I tried to do this in my previous NHS hospital, and they didn't want it, but I do hope I can I'll remain in private practice, but I do hope I can set one up in NHS, because I don't think it's fair that Black women have to come and pay for this when others don't. Obviously I have to make a living, but I do feel I've been in NHS since the beginning, since 2006. I still feel very bad taking people's money. It's not why I, went into medicine. And because I feel so passionately about skin of color and hair loss, especially Afro-textured hair, I really feel for them. So I'm hoping, I didn't say before, that I'm hoping that I can do this at some point on the NHS somewhere.
Yeah. That'll be wonderful. But the things as well, the whole thing of practicing privately.
Yeah.
I think as a British doctor, it's something that you grapple with, isn't it? Because we're so used to like this healthcare system.
Yeah.
To pay for healthcare, but we've also got to think as well that you've got to practice the kind of medicine that you feel right about, and sometimes it's difficult to do that under the NHS.
It is. You're limited. And the waiting list, you kill yourself sometimes really trying to help, and there's other priorities. So I can't be in that NHS and say, no, I only want to see black hair. No, I can't do that. There's skin cancer, there's eczema, there's psoriasis. I can't do that. You can't discriminate. So I think a mixture. But for now, with motherhood flexibility, I think this is working. But yeah, in the long term,
I think it's important to have private care as well, because sometimes the NHS so much. Sometimes you can't wait, and I think it's really important to have excellent doctors that are also offering it at a place where you can have more autonomy about when you get your care and who you get your care.
Yeah, and the time you can give more time. I would always run late in my clinics because I just can't. Well, it'll be worse. You'll understand this. I just.
Oh yeah, I just run late. This is why I work 3 days a week. I work full-time hours in those 3 days because.
Really.
Yeah, because I don't know how to.
Me too.
I don't know to say 10 minutes is really short.
It's so short. And imagine for a hair loss patient, 10 minutes. Imagine you've been waiting so long, and that there's this psychological impact as well. I can't kick you out in 10 minutes. No, I won't do it. So yeah. They don't like me so much for that reason. NHS clinics.
Honestly, Sharon, thank you so much. So
much
for this chat. It's been a wonderful chat. Honestly, I've taken so much from it personally as well. But I hope that you guys that have watched as well, you've been able to see another Black woman's story. And honestly, Sharon, you're a force to be reckoned with. And
thank you. Thank you so much.
Yeah. So enjoy your time in the US, and all the best with doing all this with your family there with you as well. I will leave in the link below anywhere where people can find you. I found you on Instagram. Is there anywhere else that you connect with people, or is Instagram the best place?
Instagram is the best place for now. I will develop a website. It's on my list. I will do it at some point.
On my list as well. Yeah,
it'll happen. Yeah, when it happens, you'll see it on my Instagram.
Great. Brilliant. Well, thank you for joining us.
You're welcome.
And to the viewers, if you haven't already, please subscribe. We have more guests coming this month where we've listened to their amazing stories, and also subscribe for more medical content, lifestyle content. And if you haven't already, please like this video and share it. Until next time. Bye.
Bye.